What is anatomy? The study of structure of human body called anatomy. What is physiology? The study of functions of organs in the body called physiology. What is a cell? The basic and structural unit of life. Name the 4 basic tissues: epithelial, connective, muscle, nervous tissue. What is homeostasis? Maintenance of stable internal environment called homeostasis. Is called longest bone in the body. The functional unit of kidney, nephron. Normal pH of blood 7.35 to 7.45. Main function of RBC, transport of oxygen through hemoglobin. Pacemaker of the heart, SA node. Largest gland, liver. Layers of the skin, epidermis, dermis, hypodermis. Function of cerebellum, maintains balance and coordination. How many cranial nerves are present? 12 pairs. Normal heart rate 60 to 100 beats per minute. Respiratory organ, lungs. What is inspiration? The process of intake of air into the lungs called inspiration. Function of stomach, digestion of proteins. Bones of forearm, radius and ulna. What is synovial fluid? Lubricating fluid present in between joints. Location of the heart, mediastinum. Covering of heart, pericardium. The layer that covers the heart is pericardium. Heart wall layer, epicardium, myocardium, endocardium. Chamber of heart, 2 atria, 2 ventricles. Valves of heart, mitral valve, tricuspid, aortic, pulmonary. Largest artery, aorta. Largest vein, inferior vena cava. Heart sound lobe, formed by closure of AV valves. Heart sound duct, formed by closure of semilunar valves. Normal BP 120 by 8 mm of Hg. What is pulse? Rhythmic arterial expansion. What is ECG? Recording of heart electrical activity. What is stroke volume? Blood pump per beat. What is cardiac stroke volume into heart rate. Artery that carry deoxygenated blood, pulmonary artery. Vein that carry oxygenated blood, pulmonary vein. Heart's natural pacemaker, SA node. AV node function, delays impulse. What is systole? Contraction phase. What is diastole? Relaxation phase. Primary respiratory organ, lung. Function unit of lungs, alveoli. Voice box is also called larynx. Windpipe is also called trachea. Number of lobes, lungs. Right lung contains 3 lobes, left contains 2. What is tidal volume? Air in normal breath. What is hypoxia? Low oxygen in tissue. Respiratory center present in medulla oblongata. Primary breathing muscle, diaphragm. Gas exchange site is alveoli. The process of gas exchange called respiration. What is hyperventilation? Rapid breathing is called hyperventilation. Lung covered by layer of pleura. What is dyspnea? Difficulty breathing. Oxygen carrier in blood, hemoglobin. What is apnea? Breathing cessation. Normal respirator 12 to 20 beats per minute. Tracheal ring made up of cartilage. Gas needed for life, oxygen. Waste gas, carbon dioxide. Longest part of GIT, small intestine. Largest digestive gland, liver. Bile is stored in gallbladder. The function of bile is fat digestion. Enzyme for protein digestion, pepsin. Enzyme for starch digestion, amylase. Enzyme for fat, lipase. Part where absorption occurs, small intestine. Organ producing insulin, pancreas. What is peristalsis? Wave-like movement of GIT. Vitamin absorbed by sunlight, D. Part producing HCl, stomach. Longest gland, intestinal mucosal gland. What is digestion? Breaking down food. What is absorption? Nutrient uptake. Where does protein digestion begin? Stomach. Where does fat digestion occur? Small intestine. What is chyme? Small semi-digested food. What is villi? Finger-like projection. Primary nutrient for energy, carbohydrates. Basic unit of nervous system, neuron. Largest part of brain, cerebrum. Balancing center present in cerebellum. Master gland is also called pituitary gland. Hormone for growth, growth hormone. Hormone for metabolism, thyroxine. Bone forming cells called osteoblasts. Bone destroying cells called osteoclasts. Number of bones, 206. Strongest bone in the body, femur. Smallest bone, stapes. The function of kidney is waste removal. Number of kidneys present in human, 2. What is urine? Liquid waste. Hormone regulating sugar, insulin. Site of fertilization, fallopian tube. Function of uterus, fetal growth. What is synapse? Gap between neuron. What is reflex action? Automatic response. What is CSF? Fluid protecting brain and spinal cord. Thank you all.